The hospital was a hive of activity, with nurses rushing from one room to another, doctors consulting charts, and patients waiting anxiously for their turn. In the midst of this organized chaos, Dr. Evelyn Harper moved with a calm and focused demeanor. She had just finished a grueling 12-hour shift, but there was no time to rest. A young boy, Tommy, had been rushed into the emergency room with a severe case of appendicitis, and Dr. Harper was the only surgeon available to perform the life-saving surgery. As she scrubbed in, Dr. Harper mentally prepared herself for the procedure. She had faced countless challenges in her career, from the long hours to the subtle, and sometimes not-so-subtle biases she encountered as a black woman in a predominantly white male profession. But she had always risen above it, driven by her passion for medicine and her commitment to her patients. The surgery was a success. Dr. Harper's skilled hands worked meticulously to remove Tommy's inflamed appendix, and by the time she closed the incision, the boy was out of danger. She let out a sigh of relief, knowing that she had once again made a difference in someone's life. As she left the operating room, she was met with the anxious faces of Tommy's relatives. Tommy's family, a group of white relatives, had been waiting nervously in the hallway. When they saw Dr. Harper, their anxiety turned to anger. They had expected to see a more traditional doctor, someone who fit their preconceived notions of what a surgeon should look like. Instead, they were faced with a black woman, and their prejudices immediately clouded their judgment. "Where's the doctor who operated on Tommy?" demanded Tommy's father, a burly man with a red face and a confrontational tone. "I'm Dr. Harper," Evelyn replied calmly. "I just performed the surgery on your son. He's going to be fine." The relatives exchanged skeptical glances. "You?" Tommy's mother asked, her voice dripping with disbelief. "You operated on my son? Are you even qualified?" Dr. Harper maintained her composure, though the sting of their words was hard to ignore. "I assure you, I am fully qualified. Your son was in critical condition, and I was able to successfully remove his appendix. He's in recovery now." But the relatives were not convinced. "We want to see a real doctor," Tommy's uncle snapped. "Someone who knows what they're doing. Not some. He didn't finish the sentence, but the implication was clear. The other relatives nodded in agreement, their faces filled with distrust and disdain. The confrontation quickly escalated. The relatives began shouting, demanding to see the chief of staff and accusing Dr. Harper of negligence. Their voices echoed through the hallway, drawing the attention of other patients and staff. Dr. Harper tried to explain the situation, but her words were drowned out by their anger. Finally, Dr. Richard Matthews, the hospital's chief of staff, arrived on the scene. He was a tall, authoritative figure with a reputation for fairness and integrity. "What's going on here?" he asked, his voice cutting through the noise. This woman claims she operated on our son," Tommy's father said, pointing accusingly at Dr. Harper. "We want to see a real doctor, someone who knows what they're doing." Dr. Matthews frowned, his eyes narrowing as he took in the scene. He knew Dr. Harper well and had the utmost respect for her skills and dedication. "Dr. Harper is one of the best surgeons we have," he said firmly. "If she operated on your son, you can rest assured that he's in good hands." But the relatives were not swayed. "We don't care what you say," Tommy's mother retorted. "We want a second opinion. We want someone who looks like they know what they're doing." Dr. Matthews sighed, realizing that the situation was not going to be resolved easily. He turned to Dr. Harper. "Dr. Harper, can you give us a moment?" Dr. Harper nodded, her face a mask of professionalism, though inside she was seething with frustration and hurt. She stepped away, leaving Dr. Matthews to deal with the irate relatives. "Listen," Dr. Matthews said, his voice calm but firm. "I understand that you're worried about your son, but I can assure you that Dr. Harper is an exceptional surgeon. She's saved countless lives, including your son's. If you don't trust her, you're not just insulting her. You're insulting this hospital and everyone who works here." The relatives hesitated, their anger momentarily tempered by Dr. Matthews' words. But before they could respond, a nurse rushed up to them, holding a chart. "Mr. and Mrs. Thompson," the nurse said breathlessly, "your son is awake. He's asking for you. The relatives' faces softened, their anger replaced by relief. They followed the nurse to Tommy's room, leaving Dr. Matthews and Dr. Harper behind. As they entered Tommy's room, the relatives were greeted by the sight of their son, pale but smiling, lying in the hospital bed. He looked up at them with bright eyes, clearly relieved to see them. "Mom, Dad," Tommy said weakly. "The doctor saved me. She was amazing." The relatives exchanged guilty glances, their earlier anger now replaced by shame. They realized that they had been wrong to judge Dr. Harper based on her race and gender. They had let their prejudices cloud their judgment, and in doing so, they had insulted the very person who had saved their son's life. As they left Tommy's room, they found Dr. Harper in the hallway, speaking with Dr. Matthews. They approached her hesitantly, their heads bowed in contrition. "Dr. Harper," Tommy's father began, his voice trembling with emotion. We owe you an apology. We were wrong to judge you. You saved our son's life and we're so sorry." Dr. Harper looked at them, her expression calm but firm. "Thank you," she said simply. "I appreciate your apology, but I hope you'll remember this moment and think twice before judging someone based on their appearance. We're all here to help, and we all deserve to be treated with respect." The relatives nodded, their faces filled with remorse. They knew that they had been given a second chance, not just to make amends with Dr. Harper, but to learn from their mistakes and become better people. In the days that followed, the relatives made a concerted effort to show their gratitude to Dr. Harper. They brought her flowers, wrote her thank you notes, and even made a donation to the hospital in her name. But more importantly, they began to question their own biases and prejudices, realizing that they had been wrong to judge someone based on their race or gender. Dr. Harper, for her part, accepted their apologies with grace and dignity. She knew that change didn't happen overnight, but she also knew that every small step counted. She continued to do her job with the same dedication and passion, knowing that she was making a difference not just in the lives of her patients, but in the hearts and minds of those around her. As the days turned into weeks, the story of Dr. Harper's noble gesture spread throughout the hospital. It became a symbol of hope and a reminder of the importance of judging people by their character and actions, rather than their race or gender. Dr. Harper's colleagues rallied around her, offering their support and admiration. They knew that she had faced countless challenges in her career, but they also knew that she had always risen above them, driven by her commitment to her patients and her belief in the power of medicine to heal not just the body, but the soul. And as for Tommy's relatives, they became advocates for change, sharing their story with others and encouraging them to look beyond their prejudices. They knew that they had been given a second chance, and they were determined to make the most of it. In the end, the story of Dr. Evelyn Harper and the noble gesture that saved a young boy's life became a powerful reminder of the importance of compassion, understanding, and the belief that we are all capable of change.